In this example from Parkwood Academy, Hollie tells us about the approach to leading early intervention and her different waved approaches of targeting children and young people, identifying their needs earlier, how she's trained all the staff to identify needs earlier, how she's using active listening and positive relationships amongst staff and students to notice issues earlier. They have 854 children in that school, and 300 of them are engaging in wellbeing interventions to promote mental health and wellbeing and protect the onset of mental health problems getting worse. They have a whole range of different agencies that they work with. They have mapped out provision in a waved approach so that they can step up and step down targeted intervention earlier, and their work is truly amazing and making a massive difference to all the young people in that school and their community in Sheffield. So I do hope you enjoy this example. Like and subscribe our YouTube channel for more ideas and inspiration, and also feel free to join Wellbeing Club, which is the program Hollie engaged in that for over a year, which is an online library of training, CPD and resources for senior mental health leads. There are videos on this channel which talk about Wellbeing Club in more depth. So I really hope you enjoy what Hollie has to say and the amazing work of Parkwood School in Sheffield.
We currently have a Wellbeing Hub within our school that I am part of. So I'm the Wellbeing Officer and the Senior Mental Health Lead. And we also have a school counsellor that supports the wellbeing of our school.
What were you doing before as a school? And then what made you join the programme? And then we can talk about how it's helped after that.
Yeah, so I started at Parkwood 3.5 years ago, and there was no real established wellbeing hub. It was the idea that they wanted to create something, and the right person to get into that role was going to sort of be the leader of that sort of idea. So over the last 3.5 years, we've grown to 2 members of staff, where we've got a school counsellor, as I've mentioned, and then obviously me as the wellbeing officer. And our hub is now an opportunity for students to access drop-in sessions, to complete interventions. We have over 7 different external projects running, charity-based ones and ones that we fund. And it's an opportunity for students to have a safe space. It's a place for them to regulate, and it's also a space for staff to access. So over the last 3 years, we've grown it from just interventions to it creating this whole school approach of providing safety, providing an opportunity for supportive conversations and meetings, a place where we can do mediations, an opportunity for do one-to-ones and group interventions. So it crosses over all that line. And then the plan moving forward is to continue the development and building of the Wellbeing Hub. And obviously everyone knows 2021 coming out of COVID was really difficult. So it first started there, but we now do interventions. And I know a lot of interventions used to be about naughty kids. I don't like to refer to them as that because I don't think it is. It's kids struggling, potentially with behaviour stuff or potentially with stuff going off at home or whatever. But interventions used to be based around them. And now we're looking at students, and we've changed our whole theory on it of students that might be low self-esteem, clearly have strength somewhere, but are struggling in another area, but they might be quietly struggling. And we're trying to build up them or positive role models in the year group, people that are influential, putting them into leadership programs and creating that ripple of, if you've got that kindness, if you've got that leadership, if you can notice right from wrong, if you in yourself have good self-esteem, when people question you, you'll believe in yourself. So then that kid will create them positive ripples. All these different things that we do. So we have like such a broad range because every child needs a different area and access to support in such a different way. And it might be supporting a staff to talk to this student and giving them the things to say, but because that person's got that good relationship with that student, that's the biggest hook.
Yes. So your role then, what percentage of the time are you doing direct work with students, would you say?
So when I first started out, it was sort of every lesson was one-to-ones. Now it's a little bit more with the mental health lead. Obviously stuff sometimes I get pulled away, but it tends to be that I'm then involved with the external stuff. So in terms of students, I think we've got around 300 students accessing wellbeing. And remember, we've only got 845. along
So
the
you've
way.
only got 845, hang on a moment. You've only got 845 students in the school and 300 of them are accessing wellbeing support. That's like more than a third, isn't it? I can't do maths off the top of my head.
Yeah.
That just makes me, that's just, I think as a snapshot demographic, probably an accurate picture of what's happening in most schools. But are you picking them? Do you think you're picking them up earlier and noticing things earlier so they're accessing support, early intervention?
Yes, in some cases we work really closely with our feeder schools. Mr. Henderson, who is sort of in charge of transition, is really, and he's my line manager. So we work really closely with making sure that literally from the get-go we've got intervention in place. So we've currently got 6 students on the Sheffield United programme Inspires already from September. I think it really helps with the external projects coming in. So we've got EFD that do 44 students in year 9 that are all looking at sort of that's that positive role model, and it's got students in there that maybe aren't making the right choices that can learn from the others within that intervention, but then also to then obviously provide it out. We've also got obviously like 55 students have accessed the EFD, the Youth Endowment Project. We've got Dame Kelly Holmes hitting 15 students on the On Track to Achieve project. We have Commander Joe in that targets groups through physical activity, and then I run projects that I've got the training for. So we've got Sports Youth Trust. They do lots of different things like Boys Move, Active in Mind. So we're running all that, and then I run my own sessions. And Michelle, obviously, our school counsellor, she does 24 one-to-ones a week. So, and then we have drop-in sessions. So we were having 55 extra students in these drop-in sessions within a week. So sometimes it's students that really need that support. Sometimes it's about being proactive and just checking in and making sure students are filling that cup up or are on the route to flourishing. And then it's things like ACEs, risky behaviour. So we have a wellbeing wave 1, 2 and 3 programme at our school. So wave 1 is the pastoral support, which the head of the call progress managers, but I guess head of years, they do that level 1 check-in. You know, they know their year group in and out. They are making sure that low-level things are met. In PD, we do a check-in, so like a temperature check, so that tutors can notify when, you know, a student, they're normally a 3, which is, we do it as like 1's really good and 10's I'm not coping. So a 3 is okay. And then suddenly they're a 10, but they know something's happened in the community. And we're getting an email and then we're going to respond to that straight away. So it's not becoming firefighters. We're proactively responding to things that are happening, even when they are happening quite quickly.
Yeah.
And you've got your wave 2, which is myself, that does the group sessions like Boys Move. We've got Wellbeing in PE, so we add that to the curriculum. So PE have really bought into that and they've been fantastic. So they apply looking at resilience, self-confidence and self-awareness. Independency, sorry, is the last one that we do, which are Ofsted focuses, and they look at how does sports create them conversations, and we do that at year 7 because it's about that idea of change, and it follows in that theme. And then we've got, like I say, these drop-down days where we're covering topics where it might highlight something a student might never have thought about that, and then they bring it in. So when you look at it like that, it's a really like, this is our response, and that's how we follow it as well. So a student starts off talking to that progress manager. Sometimes, obviously, they might need to go straight to that intervention. But it follows that. They come to maybe a group session then if they need something one-to-one where it's a personal sort of thing.
So what you're describing is your pathway to intervention and your menu of intervention and how you identify which tier students are. I'm assuming wave 3 is targeted intervention for those that are quite vulnerable. Is it like they need more counselling?
Tends to be one-to-one. Wave 2 is group work, so it's normally has like more of a theme, so it's less adapted to the individual, it's more adapted to the group.
This targeted intervention pathway and like program, how has that evolved over time? Because quite often people can have loads of stuff going on, but it's not mapped, it's not organized. You don't know which student needs which thing, and it's all a bit of a mishmash. It sounds quite organized. So how have you developed that?
So obviously when I was just starting out, I was sort of wave 2 and 3. and then progress managers was always wave 1. And we came up with this wave system to try and look at where the need was. Obviously, this is in COVID times. And it was really hard to do wave 2 actually, because any group work wasn't able to do. So how do you sort of support students as a mass to make, because sometimes one-to-one's a bit intense, it's not really that student. And definitely for year 7s, 8s and 9s, group stuff seems to work out better, because that feeling of I'm not my only person going through this.
Yes.
Myself and Michelle, obviously professionals, have a really good understanding of what's going on in students, and the way in which we do it is staff refer, and there's a really good referral online form that they fill out, and it's really in depth, so it talks about what the student's going through, and we've given it 8 different topics of things like, are they experiencing risky behaviour, is it ACE, is it concerning behaviour, is it personal development, and bereavement, things like that. And then we ask what support's already in place, so one-to-one check-ins for the last 4 weeks, but it's seeming to be becoming more problematic, or that they're still struggling. And then it might be that have a TYT worker, or they have maths involved or whatever, and you have all this information. Then what myself and Michelle do is we meet and go through it, and we look at it, we speak with the staff, or we might even speak with the child and say, what's going on, things like that. And when we make a decision of whether they think, that would be really good for, they've got low self-esteem, and we've got 4 other girls in that group, and they're struggling with friendships, let's put them into a group, let's create this sort of like social a social group around friendships and building up sort of a self-esteem. Or it might be troubles at home or in the environment, and it might be that personal need, and they might need to explore. So Michelle's focus is around exploring the feelings, because we might not understand what's going on. I look at providing coping strategies and working with the students once they understand what's going on. So we've got that. They might go to wave 3 with Michelle, and then they might come back to me to then build on that, what they understand. So I now realise what the problem is, or what the area of what I'm struggling with. This is now what we can do to support it. They might come back to a group session, because now they've got that, but then it's about how can it might be, when really poor sleep and exercise. So let's look at how we can educate them on good sleep patterns, things that we can do to reduce stress, the importance of exercise. Maybe they do one of the different projects that we've got running with that. And then last year we really looked at external, so they're wave 4, and the wave 4 not because it's more severe, but in terms of just their external. And we look at the different projects we run there, so we try and get as many different ones in. So we've got from one-to-one mentoring to group work around well-being to leadership skills ones to the brink of being excluded or not feeling included. So we try and get as many different external agencies in that aren't obviously ones that are part of the council or, mass council, social work, things like that. We've tried to come in with both sides so that they're getting that support at home, they're getting that support in school. And then it's really more about us understanding the students. And me and Michelle work really hard, and the staff work really hard to really understand what's going on, so that we can look at a child and say, actually, you need this. And then I work really closely with the external support, so that when that support finishes, it's not, we're done with that, off you go back to lesson, you're fixed. It's, so what did we learn from that? Is there something that, if they've gone in it because they're doing regulation, have they then realised actually they've got low self-esteem as well? So is there a one-to-one thing we need to do with them? Or is there a different group we can put them in? Or is it, let's do some mentoring so they don't feel like we've completely left them to sort of. So there is this really structured, really broad support network in which we're not just, we're doing this, tick box, done. It's how are we, and then it's that progression through. So
I just love that, like that you've got such a robust and a real understanding of how all the interventions work together, because I hear a lot from schools, there's just nothing, there's no support. But also what I also have heard is the acknowledgement and acceptance that you have to do it yourselves, because you have to do more early intervention and develop your own program of early intervention in-house in your school, that because there is a lack of CAMs, and there is a lack of like stuff out there. So in order to meet your students' needs, you've had to be very innovative and create access to stuff that is out there, but also create a place in your school to identify needs, put things in place, and do a lot of it yourselves. I don't think schools realise that they have to do a lot of targeted early intervention themselves.
I think we're lucky because we've got this Wellbeing Hub, but the schools that don't have a person like myself or Michelle, and that's where the problem comes, because there isn't enough time to maybe, you know, my whole focus is wellbeing. I look at everything, and I am that passionate about it. I think I go above and I try my best to do every single area that we possibly can and meet them needs. So if this, and also it's about looking constantly for areas where we're not improving. So I mentioned earlier that wellbeing ambassadors is something we really want to push next year, because we've got all this adult support, but there are students that just don't feel comfortable talking to adults. It might be because of ACEs, it could be because they just don't think we relate to them. So now it's looking at peer support and how they can help with multiple different things, because in Boys Moving, a lot of the training that you talk about, the amount of like day-to-day wellbeing improvements because of them relationships within peer groups, because they're the ones that are interacting with the most. They're the ones that can stop them wanting to be at school. So if we've got these people that are positively impacting on the students, and they actually understand that they're going through Parkwood right now and they're experiencing everything the same. I didn't go to this school. I don't know what, I can't 100% understand what they're going through. Obviously, I'm a staff member there, but and in the areas, they all live from similar areas, so they understand the challenges that maybe are in this area. So it's constantly thinking, what bit aren't we supporting? What area aren't we doing something on? And making sure that we're looking for stuff to support them. Same as coffee mornings, we've started them up where we get parents in to talk about mental health and well-being and giving them support, so at home they're able to have difficult conversations. I think that's the biggest thing at the moment, is how do I talk to my child about this difficult conversation? And again, signposting to places is good, but you get so many times, because they're overloaded, kids going, I messaged this number and they didn't reply, or I went to do this and they just gave me have a bath, and I'm like, yeah, it's a bit rubbish that. So what can we do? And we are lucky that, you know, our school backs wellbeing and sees it as the foundations. Miss Cottingham is fantastic at looking at resources and saying yes to whatever we're trying to do, as long as obviously we can feasibly meet them needs.
And what you've done is fantastic. Like, don't, like, you know, you're saying always looking to improve. I'm like, stop a minute and reflect on what you've done and how flipping amazing it is, because like, it's best practice. What you're describing is best practice. You know, you always want to improve and tweak stuff, but the fact you've got a wellbeing hub, the fact you've got dedicated staff, the fact you know the kids and can identify their needs, the fact you've got a menu of interventions that meet different needs, that they can go, you know, step up, step down, all of that. You're working with outside agencies. Everyone's on the same page. Staff know how to refer in. Staff understand the intervention. Do you know what I mean? There's so many like tick, tick, tick. I'm like, yeah. I'm going to leave it on that, because that's such a good point. I could talk to you forever about your work that you've done. It's so interesting and amazing.
I have to visit instead.
I would love to. Thanks, Hollie. Thanks for everything. Thanks for being such a wonderful member of Wellbeing Club for the last year and taking the stuff. I mean, you can join a program. Whether you access it and use any of the stuff, it's not going to work if you don't use the stuff. So, you know, you have used it. You have used it loads and loads. I mean, there's probably still loads more you could have done, but you've taken things and run with it. And that, for me, is the most important thing. And it's making a difference to your school. So well done. I appreciate you for that. And I just hope it has a lot ongoing, I'm sure it will, from what you've said, a ongoing lasting legacy, you know, that evolves over time. And yeah, I look forward to working with Parkwood more in future.
Yeah.
And you. You're a superstar.
Well, can only do it with, you know, my tools, and you're clearly the superpower. That helps me along the way. So, like I said, it's just nice to have people working together and supporting each other.